Welcome to The Briefing. I'm Shannon Marvel. The NHS is a service many of us rely on, often with the quiet reassurance that it will be there when we need it most. For some, it's more than just reassurance, it's a lifeline. But when this lifeline fails, the consequences can be deeply traumatic and in some cases life-altering. Over the past 5 years, NHS Highland and NHS Grampian have paid out a combined £34 million in patient compensation. Meanwhile, the Scottish Government have criticism for leaving frontline staff dangerously overstretched, a situation that is increasing the risk of errors and puts both patients and professionals at a greater risk. Today, Scott MacLennan is here to make sense of it all. So Scott, looking at these numbers, it's quite a large sum of money that we're talking about the past 5 years.
It is large. It's not necessarily as surprising as it appears in the face of it. 34 million was accounted for across NHS Highland and NHS Grampian. That's a huge swathe of Scotland with a very large population, even though it is largely rural. You have to consider the challenges that are faced by the health boards. NHS Highland alone stretches from John O'Groats in the north to Campbellton in the south, which is geographically to the south of Glasgow. NHS Grampian is a very busy health board. Very busy. It has a huge range of operations that it conducts, a huge range of services. And so there is an understanding that they would be facing challenges, particularly at this time of crisis for the National Health Service in Scotland. If you look at some of the reasons why compensation has been paid out, take NHS Highland to begin with, you see again and again the phrase diagnosis failed or delayed. That usually stands for misdiagnosis or delayed diagnosis, but that's clearly got serious consequences for patients. Nobody wishes to have a delayed diagnosis. You can imagine quite easily a cancer patient waiting to find out if, in fact, they had cancer or not. It's extraordinarily worrying, and it wouldn't help their mental health or their sense of well-being. Elsewhere, there were incidents in midwifery, in labour or delivery, and there were also general surgery incidents. That's obviously a very complicated field. It's fraught with dangers and challenges for the professionals that deal with those sorts of procedures. But you see this phrase, diagnosis failed or delayed. In obstetrics and gynecology, there was even an incident of what they called an accident that may result in personal injury. There was also radiology diagnosis, again, failed or delayed. Child and adolescent mental health, diagnosis failed or delayed. It's a bit worrying, but it's understandable in the sense that all of these specialities are under extreme pressure at the moment. If you were to turn to NHS Grampian, they paid out much more. But again, in some ways, it's a busier health board in that it does attract more patients because of the specialities and procedures that they are able to conduct. In Aberdeen, paid out 23.7 million to patients for dozens of treatments that apparently did not go well. The issues there were defined in a slightly different way where they named them, and it extended across a broad range of specialities. That ranged from A&E to urology, so it's almost the full extent of what they had to offer there. Specifically, the worst years for NHS Grampian was from 2020 to 2022, where they paid out 6 million each financial year in that period. Then there was a dip, and then it again more than quadrupled to 5.8 million for the most recent year that we have presented there. But it's clear evidence of challenges faced by the National Health Service.
And when we look at NHS as a whole, the Scottish Government have an NHS recovery plan between 2021 and 2026. Their aim is, for example, say A&E just as one department. They want 95% of patients that should be seen, admitted, discharged or transferred within the 4-hour period. When you look at the Highlands NHS and NHS Grampian, that's not reflective of what they see and what they think that they've improved from the annual report of 2024 as well. I feel like NHS Highland and Grampian don't really reflect what the Scottish Government see as a whole for NHS Scotland. Does that make sense?
In a sense, yes, because there's always outliers when it comes to statutory services in rural or mostly rural or partially rural areas. There's always seems to be outliers. So, for example, an emergency department in an urban area might be higher performing than one that's in a slightly rural area. The turnaround times in previous years, Rigmore had done extremely well in terms of meeting the delivery times that was requested and sought by the Scottish Government. And as you mentioned, that's not been the case as much recently. I think what you're seeing is to break a bit off it, because it's such a large problem, if you try and address it all, you might never finish speaking. Ambulance turnaround times, which is clear reference to A&E and emergency, or pressing admissions to hospitals, the amount of time that ambulances are forced to spend idling outside of hospitals waiting to get patients admitted has increased by 16%. Last year, it hit 14,544 hours. That's a rise of 606 days of ambulances basically sitting, not able to do their job, outside of hospitals waiting for a bed to be freed up. You hear of other reports elsewhere. There's a well-known example of an ambulance having to wait 32 hours to get a patient admitted. We followed that up and had another look at what the worst turnaround times were for ambulances. And that shows a clear progression, or regression, in fact. In 2021, the worst wait was just under 5 hours. The next year, 2022, it was more than 7 hours. By 2023, the worst stood at well over 8 hours. And by 2024, the turnaround time was again up. And this time it hit just under 10 hours. That's a long time.
And is that 10 hours for one ambulance?
Correct. Just waiting with a patient in the back. Now, it's important to underline at this stage, nobody's accusing the ambulance nor the hospital staff of having done anything wrong. The only reason I say that is it is the fact of the pressure that's in the system and they can't escape it. It's just something they've got to do. They can't just place them in a chair. They've got to wait with them to ensure the good of their health. It's not like they're doing nothing there, waiting. They're making sure that the patient is safe, is medically secure. And if something happened, I'm 100% certain there would be a reaction to it. But these are the slightly less urgent cases. So, for example, someone taken in from a car crash would almost certainly be seen instantaneously. Someone suffering from a serious heart attack who's unconscious would almost certainly be seen instantaneously. It's those patients that are just need to be assessed that are suffering these waits, which is obviously not good for them. And certainly no paramedic, no crew member of an ambulance would ever want to be waiting there because it takes them off the road. We asked the Scottish Ambulance Service what they think about that. And they were very clear. And they said, these waits prevent our crews from getting out onto the road to treat other patients, and we're working closely with health boards, including NHS Highland, to support their efforts to improve the situation. The health board said something pretty similar. They're working on identifying the cause of the waits. They're arranging meetings between the emergency department and admissions staff. They're trying to open extra space and increasing patient movement and bed flow. But ultimately, it comes down to the fact there's too many people in the beds. And that, NHS Highland says, is for our patients who are ready to leave hospital, we're experiencing high levels of delay. And the reason for that is finding a suitable onward placement or accommodation that can meet the specific care needs of the individuals waiting to be discharged. So that's where much of this problem lies.
And this is sort of relevant in an older generation where a care home might have to be included in the situation. Are they have to be NHS, or are they going to go to a private care home where that assistance still needs to be met because the person still needs to get to that place?
You could expand it to care packages as well. Highland Council, which has a role in providing care, is keen to move to more care at home settings. There's lots of reasons for that. One, it keeps people independent for longer, so they're happier. A lot of elderly people do not want to leave their home to move into a care home. Some do. Some are quite content. But a lot do want to remain at home, and facilitating that independence is obviously preferable. But there's simply a shortage and a lack of availability for this service at the moment in the Highlands. And in the Highlands, it's particularly problematic. And it's been evidenced pretty well, I think. I mean, it's something that we've known for quite a few years. But the MP, Angus MacDonald, published a fairly detailed report, having gone and talked to about 81% of the care homes. He tried to talk to all of them, but he got responses from 81% of the care homes in the Highlands. And they're looking after about just under 1,300 people. The findings put in black and white are quite startling. Again, it's what we've largely known before, but when you see it in black and white before you, it's quite arresting. There's been a 72% rise in people aged 75 and over between 2001 and 2023. By 2028, that will have risen another 34%. At the same time, the number of care homes for older people fell by 18%, and that was between the years 2014 and 2024. That's public sector. The private sector fell even worse. It was down by 29%. There's also a huge squeeze on the number of care homes on the West Coast, which has obviously got a more dispersed population. It's more rural, but even in places such as Fort William, which is a population centre, there is and remains a need for more care homes. This is a significant problem. A counsellor, who is also a doctor, I think about 18 months, 2 years ago, said, Rigmore works because the care sector works. If one fails, the other will. they can't do their job, and they can't simply eject people onto the street without a place to go, particularly if they're old and vulnerable and need care.
But we're seeing that imbalance already.
It's already present. It's in the system. It's such a struggle for these organisations to find a safe place for people who need to be, whether looked after round the clock or just partially, whether it's a little bit of assistance with medication or whether it's a bit of cooking or just generally looking after themselves. That is not available to them at this stage for too long a time, which is causing a backup all the way through the system. It's not the only problem. If there was an ability to resolve that, the pressure on the health service would certainly lighten. I'm not saying it would vanish. It wouldn't. But it would certainly lighten the load. And every clinician I've ever talked to would say the same thing, has said the same thing.
I think everyone has very similar stories of chatting to someone who works in healthcare, whether that's in a care home or within the NHS. They're saying exactly the same thing. They're just busy. They're busy all the time. And
it never stops.
you kind of think, oh, it's whatever. But when you actually look at the numbers, it's quite worrying. So we see why people don't go into that business as well. Definitely the care system as well. There's so much to do.
It's a serious question. A part of the study that was conducted by Angus MacDonald states that more than 90% of independent operators said the national insurance hikes were significant or somewhat significant for their operations and financial sustainability. This is an area where you need independent operators because those charged with operating care homes are unable to establish them in every single part of the region. And it's quite difficult to maintain it well. But a lot of independent operators do. They sometimes get a bad name, generally speaking. But a lot of them are extremely devoted to what they're doing and do it well. And they are having financial pressures put on what is essentially, in market terms, a high demand for their service. But they can't break even. So that's a financial aspect to it, which is also problematic and hasn't been resolved.
The NHS recovery plan is working between 2021 and 2026. This recovery plan is backed with over £1 billion of targeted investment up until 2026. Are we seeing any of that investment up here?
Yes, it has come through into the NHS Highland budget. It's increased. It's now getting close. The total budget for NHS Highland is now getting close to £1 billion in revenue spending. One of the issues, however, is that there's no capital spending, so they can't improve facilities. If you're sticking with the topic of care, that is a clear and present problem because NHS Highland would be unable to invest in, for example, a new care home with Highland Council. So it's a dual care model. They're both responsible for it to varying degrees. The money's coming through. Will it work? It's difficult to know. The general consensus is that Rigmore's past its sell-by date. It was made in the 70s and it needs improvement and modernisation. There's never going to be the money for that in the near future. It would be a difficult ask for that. There are plenty of opportunities around Inverness. You see the UHI campus. But what you're doing is essentially delivering the best possible services within buildings that are largely not that great. We have recently received the National Treatment Centre, and that is helping. But it's helping in one area. It's not exactly helping in, for example, the area where you need to alleviate the waits for care, whether it's a care package or a care home placement. But the money has certainly been delivered in this year's budget, and I would expect it will be continued to be delivered. It's not yet clear what will happen in the coming months regarding the fate of care and the NHS in terms of this particular crisis. It has been said, it has been noted that, and certainly this is more a position that's been adopted within Westminster rather than in Holyrood, that throwing money at the NHS without reforming it is a waste of money. But I kind of take the Scottish Government's point that this is a sort of crisis that can't wait. There might be a mortality rate if you did wait, whilst accepting the logical position that there is need for reform in the NHS across the country. But what action can be taken to alleviate it is difficult. Angus MacDonald proposes £60 million for several new care homes, along with housing for staff along the West Coast. He believes this would alleviate the care crisis in the Highlands. He might well be right. It cost about just under £155 million to the NHS in terms of delayed discharge over 10 years. So when you would imagine that care home certainly being functioning for decades to come, if it was well constructed, it was well made, and it was well delivered, and it was staffed. And then there's the £30 million that was lost in the National Care Service initiative, which, while no doubt done with laudable intentions, it didn't work. It remains to be entirely seen how much it could have worked, but it hasn't worked. And that's millions of pounds lost, which could have been diverted into the NHS and better spent. There's not any easy answers when it comes to the NHS, but there is something there that is significantly in need of change, and there is parts of it that are broken, because that's what the doctors are saying, that's what the nurses are saying, that's what some of the administrators are saying, and they would know better than me.
Well, I think in that case, we shall leave it there. Thank you very much.
Thank you.